doubt about it. You can do this job that I have to do. No doubt. Does this mic work that's sitting right here? Do I need to hold it?
This is the one that you're going to hold.
So I got to hold this?
Yep, hold that one and then pass it to Dr.
And I turn it over to you for a second.
Carolyn, I'm up after you. Yeah.
Okay. Everybody ready?
We're ready.
All right. Well, good morning and welcome and thank you to everyone that is here for this really important opportunity to talk about what is happening coming at us from the President and the Republican Congress that is going to impact absolutely everybody. We're going to see more people who are sick, more people who are starving, more tax breaks for the wealthiest people in the country. That is what the Republican agenda is. And that is what is at the heart of this big, ugly betrayal bill that the President and the Republicans are passing and moving heaven and earth to put into law. And that is exactly why we're here today, to raise the alarm. We are hearing a lot of empty Republican untruths about their bill right now. We're hearing a lot of desperate spin, and that's because the reality of this is really catastrophic. If Republicans pass this monstrosity of a bill, billionaires like Trump and Musk are going to get away like bandits. Struggling families, however, are going to have their entire world upside down. They're going to lose their health care. They're going to lose food assistance. They're going to see their costs go up and the support that they rely on go away. Now, when it comes to health care, we are talking about 16 million people being kicked off their insurance. 8 million people, 8 million of that will be cut off from Medicaid with the new paperwork requirements and red tape. 4 million will lose ACA coverage due to Republican sabotage, and another 4 million will lose their coverage if Republicans refuse to extend the health care tax credits that they now have. So what we are seeing Republicans do is whatever it takes to extend tax cuts for big corporations and the richest of the rich, and to do that, they're going to kick people off their health care. This will shut down our rural hospitals and take food off families' tables, right off kids' plates, you name it. But when it comes to the health care tax credits that Democrats passed for everyday Americans or extending relief that is saving millions of families thousands of dollars a year, crickets. Republicans will not be bothered. Here in Washington State, this Republican disaster would take health care away from over 300,000 people, minimum, 200,000 from Medicaid alone. And yet the Republicans whose constituents have the most to lose here, and the people representing who are most reliant on Medicaid, represent the people who are going to be hit the hardest. They're full steam ahead on this bill. So I hope everyone asks them why, because I can't figure out why for the life of me, someone who represents nearly thousands and thousands of people who will be kicked off their health care or lose their food and nutrition programs would want to support this bill. What voting for this bill means is voting to kick seniors out of nursing homes. It is voting to shut down rural hospitals. It will take coverage away from kids with disabilities. And Republicans, by the way, aren't content to just take families' health care away. They want them to go without food. This bill would make the biggest cut to SNAP in history. In history, we're talking about $250 billion cut over the next 10 years. Now, it should be obvious that that would be devastating for our country, from saddling our states with unprecedented costs to saddling families with more red tape. The outcome is going to be less families getting SNAP benefits and more kids and families going hungry. In Washington State alone, Republicans' bill would put 150,000 people in our state at risk of losing their food benefits. And the new red tape that they have in here is targeted at some of our most vulnerable families because it expands the work requirements to apply to seniors and parents with kids in school. That is who Republicans want to take food away from. And again, and I can't emphasize this enough, Republicans want to cut families off from SNAP and Medicaid, programs that just give families a hand up in hard times. Why? So they can give enormous handouts to the richest people and biggest companies in the world. Now look, I am someone who knows what it is like to have your family fall on hard times. I am someone whose family, when I was growing up, relied on food stamps briefly. I am someone whose own parents told me that they crawled to get to Medicare. So you can bet I will fight like hell to make sure this bill goes nowhere except the trash bin. Look, this is not going to be an easy fight, but it is not an impossible fight. It is an absolutely important one. It's so important to remember that back in the first Trump administration, they tried to repeal ACA. What happened? American people stood up, they shared their stories, they said what this meant to them, and the country said, no way. Their voices were heard, and that bill failed in the United States Senate. So that is my goal now, and I'm going to do everything I can to make sure people's voices are heard once again. I'm going to make sure that every Republican who is even considering voting for this bill doesn't get off the hook. They need to know exactly what they're voting for and what difference it will make for families in our state and across the country. So that is why I'm here today, and I'm so proud to be joined by people who really know personally from their own work and from their own experience just how important these programs are and just how catastrophic this Republicans' big, ugly betrayal bill would be. So first of all, I want to thank Dr. Angela Griffin. She is the CEO of Bird Place, where we are here today, for hosting all of this. This is an amazing place. Thank you to all of you who make this happen every day. Thank you for the great tour. Thank you for the work you do. I am going to turn this over to hear from our first speaker, Dr. Re. She knows firsthand what these cuts will mean. Dr. Re.
Thank you, Senator Murray. Thank you, Senator Murray. My name is Leila Re, and I am a pediatrician. Medicaid is a lifeline for nearly half of Washington's children. It serves kids living in poverty, those in foster care, and those with severe medical needs and disabilities. For them, Medicaid is not just an insurance card, it's access to life-saving care, therapies, medications, and specialists. The proposed cuts to Medicaid would be devastating. They would limit access to basic care and lead to entirely preventable health crises that cost more in every way, in dollars, in dignity, and in children's lives. Sometimes a family relying on Medicaid is one that recently lost a job. Their kids used to have commercial insurance, and now they depend on Medicaid just to get immunizations and checkups. Sometimes families who rely on Medicaid are families whose children have struggled since birth. A colleague of mine who works in the intensive care unit shared the story of a 2-year-old girl who had defied all the odds and survived a life-threatening birth defect. She has developmental delays and needs a lot of help, including a home ventilator. Though her family loves her and wants to have her at home, they need to have the help of home nurses who are paid for by Medicaid. Medicaid pays home nurses so little that it's been difficult to find qualified people to help them. And so this little girl has spent most of the first 2 years of her life living in the intensive care unit, amongst the beeps and alarms and chaos of the hospital. Her family needs to work and can't visit so often, so her main social activity is the doctors and nurses, taking short breaks from taking care of other kids to press play on the next Disney movie. Apparently her favorite is Moana. My friend shares that this little girl is loved like family by the staff, but that further cuts to Medicaid will keep her from growing up with her actual family at home. Sometimes children who rely on Medicaid are children in foster care. Another colleague of mine, a primary care pediatrician, shares the story of a 3.5-year-old little girl in foster care who survived horrific abuse as an infant. Now, over 3 years later, she has a decked-out walker with purple tassels and a gastrostomy tube through which she gets all of her nutrition. She's catheterized throughout the day to pass urine and sleeps with CPAP at night. She needs extra oxygen when she's sick. And she is the spunkiest, happiest survivor you could ever meet. Her foster parents want to adopt her. They're the perfect home for her, but they're terrified of adopting her. with the risk that her health issues could potentially bankrupt them if she doesn't have Medicaid. Personally, I work in the urgent care. Most ERs and urgent cares are bursting at the seams. If Medicaid is cut, more children will not be able to see a doctor for appropriate preventative care or timely care for illnesses or injuries. Those kids then come to see me. They're sicker than they would have been. Asthma that could have been managed with a simple inhaler ends up with a child on oxygen and in the intensive care unit. A mild infection that would have just taken a few oral antibiotics becomes IV treatment and hospitalization. This is costly, inefficient, and worst of all, completely preventable. Cuts to Medicaid also ripple across the system. Pediatric specialty departments are already closing in some hospitals. Wait lists are growing, not just for children on Medicaid, for all kids, regardless of insurance coverage. Rural areas are especially hard hit, and once services disappear, it's incredibly difficult to bring it back. This isn't just a policy debate. It's about real children, real families, and real consequences. Medicaid cuts are not abstract budget line items. They're barriers to care, obstacles to safety, and roadblocks to children growing up healthy and whole. I and the other pediatricians of this state urge lawmakers, protect our future, protect Medicaid. Washington's children are counting on you. And I'd like to now allow my colleague, Dr. Isaac, to share.
Thank you, Dr. Re. My name is Margaret Isaac. I am a primary care doctor and a palliative care doctor at Harborview Medical Center. I'm also a faculty member in the Department of Medicine at the University of Washington School of Medicine. I have the incredible privilege to care for patients from all backgrounds, all educational and education levels, all countries of origin. Harborview is a safety net hospital, and so we're particularly focused on caring for some of the most vulnerable and marginalized people in our society. And I've been in practice at Harborview for nearly 18 years, and I have seen time and time again how having insurance coverage and access to health care saves lives and prevents human suffering. I'm deeply concerned about the proposed Medicaid cuts in the budget reconciliation bill. 1 in 5 Americans have Medicaid. These are working people. These are people with disabilities. These are caregivers of children and chronically ill adults, people at the end of life. Specifically, I'm concerned about the impact that these cuts will have on our patients directly and on the ability of our hospitals and clinics to continue to provide life-saving and life-changing care. I'm thinking about a primary care patient of mine who, despite working full-time, could not afford to buy health insurance. And throughout the time I've been caring for her, at every visit, we run through a list of what blood tests we can order that day that she can afford to pay for out of pocket to monitor her chronic kidney disease, which screening tests for cancer we can do, and which ones we need to wait on because of the cost. She had previously had to file for bankruptcy due to healthcare costs, so this is not an abstract concern of hers. After a normal mammogram in 2022, we actually went 3 years without getting breast cancer screening, in part due to these serious financial barriers. And finally, she got insurance through the government, and we were able to get a mammogram for her in March of 2025. Unfortunately, this showed invasive breast cancer. She's doing well now after her surgery, but she's got a lot more treatment ahead, and I have to wonder if things might have been easier for her if we'd been able to catch this cancer earlier. In short, health insurance changes the lives of patients every day. I also work on the palliative care service at Harborview, providing care for patients at the end of life. We work with patients and their families to sort out how they can live the end of their lives with the dignity and the care that they deserve. Much of the time, this means getting care in a nursing home when a dying patient has care needs that are beyond what their family, or frankly, most families, can do at home. Medicaid pays for over 60% of nursing home costs in the US, and without this type of coverage, options are really limited in being able to get our patients the care that they need at the time that they need it the most. Cuts to Medicaid would endanger that care further. UW Medicine is the largest provider of uncompensated medical care in this state. Cuts to Medicaid seriously threaten our ability to care for those Washingtonians that need it the most. The relationships that we build with our patients as physicians transcend politics. And as a physician, supporting Medicaid to me is a moral issue of how we care for one another as fellow human beings. Those of us in healthcare bear witness to incredible suffering and incredible resilience. And I have to believe as a human being that if the national leaders supporting this bill could see what I see every day, they would move past the cruelty of these proposed cuts and prioritize the dignity and the care that all humans deserve. And with that, I'm going to pass the microphone to Sarah.
Thank you, Dr. Isaac.
Thank you, Sarah.
Senator Murray, thank you for this opportunity. My name is Sarah Brantley, and this handsome gentleman standing next to me is my eldest son, Paul Bear Brantley. With his permission, I'm going to share a little bit about our journey. Paul is 34 years old, graduated from Bainbridge High School on Bainbridge Island, and completed the TOPS transition program at Kent Meridian High School. Paul is an avid sports fan and an artist. His first job was at an art gallery on Bainbridge Island. His first art show was in Kingston, Washington. He's worked game days for the Mariners, the Sounders, the Seahawks, and most recently, he worked the game days for the Thunderbirds. For the past 10 years, Paul has been an active member of Action Club, a Kiwanis-supported leadership program. He's a past president and past treasurer of his Action Club. Paul is also a member of a classic Kiwanis club working on community service projects shoulder to shoulder with the other members. He also serves as the manager for the weekly coffee hour at St. Luke's Episcopal Church in Renton and spends one day a week working on the building and maintenance team. It's been a journey of hard work for Paul to get to realize these goals. Paul was born with developmental delays and on the autism spectrum, and he struggles with social settings and sensory sensitivities. Just before turning 14 in 2005, Paul was admitted to Seattle Children's Hospital with a brain infection. For 2 years, the medical and therapy teams worked to overcome the infection and repair the physical damage. However, survival was only the beginning of the fight he would face to relearn everything. But here we are, 20 years later. My son has benefited exponentially from the support he's received through his Medicaid coverage. As conversations swell around the cuts to Medicaid, my concerns swell for him. Access to the features of this program have created opportunities for him to not only overcome intense medical and developmental challenges, but in fact, to thrive. He has found a sense of purpose and a place of pride in his community through supported employment opportunities and community inclusion. As a live-in care provider, I'm able to support his daily health, hygiene, and safety in his own home, thereby helping him prevent setbacks while preserving his dignity. His life has literally been saved by the interventions of Medicaid. Moreover, he has found community and empowerment in the journey. He has grown to have a sense of self-pride and confidence I never dreamed possible for my son. One of my most proud moments was to be present to see my son stand on stage with the Pacific Northwest Kiwanis governor and open the conference in a packed room of professionals from across the great Pacific Northwest. My son found the confidence to address the crowd flawlessly as a result of his involvement with supported employment and adaptive recreational training. This confidence came through experiences that would not be available to him without the support of these vital services. Please don't let these services end. My son is an active and productive member of his community. He has a genuine passion for service and giving back to his community. The services found in the features of Medicaid have provided him with the necessary resources and support to be a successful and strong advocate for himself and for others. He regularly participates in service projects paying forward this humanity. Health, dental, and optical care are only features of Medicaid. Home health, hygiene, and safety are only features of the program. Landing a job through supported employment, accommodations, and respite care that provides adaptive recreation are just features of the programs that we've accessed. The benefits to these features are exponential. These benefits are not the dollars spent, but the lives that more than live. These benefits are the exponential heights to which lives are empowered and thrive. Please don't cut these benefits. Thank you. Bronte, I'll turn it over to you.
Thank you. Hi, my name is Bronte Lumpky. I live in Tacoma, and I'm a proud member of Moms Rising here today. I would first like to say thank you to Senator Murray for giving me the chance to be here and tell my story. I am a Medicaid success story. I was an addict and I got clean when I was pregnant with my son. And this was due only because of Medicaid, was able to pay for the services I needed. Now I'm proud to say that I've completed my associate's degree and will be walking across that stage tomorrow. And in the fall, I plan to attend UW-Tacoma for the Bachelor's in Social Welfare program. Medicaid, the Apple Health in Washington State, changed my whole life. It covered the medication-assisted treatment services that made it possible for me to get off the drugs and have the life I have today with my family. It also covered my son's birth and a surgery that he needed as an infant. And it makes it possible for us to get preventative and routine care today. UW requires vaccines for the Bachelor's in Social Welfare program to attend classes, and Medicaid will also cover them for me. Medicaid has kept us healthy, safe, and out of debt. We also rely on SNAP food benefits. We get $488 a month, and it's still not enough. I'm not sure how we'd eat without it. We'd rely entirely on food banks, most likely. Food prices are skyrocketing, and the other day I could not believe the price of chicken. We like to cook a lot and to give my son and my other children nutritious fruits, veggies, and SNAP makes that possible for us. I don't understand why any lawmakers think more tax cuts for billionaires are more important than food and health care for families like mine. Already seeing impacts of the looming cuts, it is incredibly hard to get medical appointments right now, as everybody is trying to get care ahead of the cuts. I myself was not able to get an appointment until August, and this was 2 months ago. I wish Congress would make childcare more affordable and invest in schools and continue supporting the healthcare and food that we need. Thank you. And next is Jeff.
Hello, my name is Jeff Toll, and I've lived in the Seattle area since the late 70s. I'm one of the nearly 2 million people on Medicaid, and I'm grateful for you to listen to my story. I grew up in Bothell, and I was employed at the same job for 14 years and had good health and coverage, and was able to raise 2 daughters, and a divorce and a couple bad decisions later, 14 years later, put me on the streets. Being homeless in this city is more than a full-time job. The resources, when you get used to what's around you and the resources that you have, such as this food bank, I used it many times, you're able to barely get by, and you don't think about your health condition if you're, getting around and doing everything. It's a second. It's not even in the front of your head. It's thinking about it. 3 years ago, you do a lot of walking when you're homeless, and my legs started to go south on me. I was diagnosed with deep vein thrombosis. I think I said that right. And nobody ever told me growing up what a blood clot. I knew a blood clot was bad, but how painful it is. I was literally stuck in bed for months on end, not being able to get food, not being able to get other things that I needed to just survive day to day. And I didn't know how to actually start the medical process or get the process going on how to get myself taken care of. I eventually ended up in a clinic and got on Medicaid, and been going through surgeries. I just got out of surgery. I was in surgery yesterday, and I had got a long way to go before things start to improve. To me, it shouldn't even be a discussion that this is even happening. Where funding for this should always be available, not just for people nowadays, but in future generations. It should not even be. We shouldn't even be discussing this, especially when they have funds for parades on their birthday, and other ridiculous stuff that the administration is got lined up for themselves. I am doing a lot better now in my living situation, and without Medicaid, I would be stuck in bed and wouldn't be able to do anything as far as progressing my life and getting out of the situation I'm in. And I'm deeply grateful for having Medicaid and the folks at UW Harborview, and they've been wonderful. And let's see. Again, guess that'd be it. And then I guess Gina is up next. Thank you.
Thank you. Hello. Thank you, everybody, for being here. It's good to be in this important fight with our Senator Murray again. I'm excited about that. My name is Gina Owens. I'm a single disabled grandmother of 3 and a member of Washington Community Action Network. I'm also a patient who is dual eligible for both Medicaid and Medicare. I am opposed to the Medicaid cuts being considered in Congress, including the additional co-pays that are being discussed. I've relied on safety net programs since 2001 when I was a passenger in a car accident that injured my spinal cord and took me out of the workforce. I raised my 3 grandkids with my SSDI since we lost my daughter, their mother, Tiffany, who passed away in 2007 after losing her health care when she lost her job. Her story was the essential story in the passage of the Affordable Care Act from President Obama. Without Medicaid, we would not have been able to get the care we needed. I'm worried that if these cuts go through, that my family and millions of other families like ours will lose access to their health care. It deeply saddens me that my family and I have struggled to do the right thing for all of these years, only to have Congress tell us that we will need to pay higher co-pays out of our fixed incomes. A few dollars may not sound like much to the majority of people, but to many like me, it can be the difference between going hungry or having our electric bill cut off. I'll call it like it is. Cuts and increasing co-pays are robbing from the poor to give to the rich. Our country has so much wealth there are enough resources for everyone to have their needs met. And I want to thank you again, Senator Murray, for standing up for us today. We have a lot of work to do on this issue, so thank you, all of you, for being here again. You'll now hear from Janelle.
Good afternoon. My name is Janelle Smith-Doseier. And I would like to give you a little bit of backstory on how I came to this place. 3.5, 4 years ago, I was able-bodied, working, had a full-time job. I was working for the federal government. And so at work where I got very dizzy and could hardly walk, could hardly think straight. Ended up going to the doctor and discovered I had a brain condition that required brain surgery. After the brain surgery, 3 months later, I had back surgery, and a year later, I had another back surgery. So I went from working full-time to becoming medically retired in my 50s, and not knowing what to do. I had to not only get medically retired from work, I had to apply for disability through Social Security. All of these are foreign and new to me, didn't even know how they work because I was in my 50s and never thought I would be at that point. So I ended up having to apply for food stamps. And to be honest with you, pride got in the way and I didn't want to do it because I was always an able-bodied person who could take care of myself and my family. I ended up getting food stamps, and then I get food stamps and my Social Security hadn't kicked in, so I was basically living off of $500, no income. But I had a very supportive landlord who understood my situation. So I was getting my food stamps, my $500. I was making ends meet, going to food banks, family was helping out. Now I'm in a position almost 4 years later, and my Social Security and my benefits have kicked in. I'm still making less than $20,000 compared to almost $60,000, so it's a huge, huge gap. The food stamps have always helped me. They have helped me and my family, actually. The food bank has helped me with the space between getting the food stamps and my food supply running out like 3 months into the month. Without the food stamps, I would have to dip into my Social Security and my retirement, which is pretty much tied up into taking care of myself outside of food, which would leave me with hardly no money to live on. Food stamps have helped me survive. They have helped my family survive. They have allowed me to put some food away, like dried goods, so that I can prepare foods more at home. And without them, I have had to learn how to be a very resourceful person as far as how am I going to keep food in my house. I no longer buy excess that I don't need. I buy what I need and live off of that. This food bank here has helped me quite a bit in bridging those gaps. And without it, I think a lot of people in my age group would be suffering because we don't really talk about us needing food stamps. We don't really come out and ask for help because we are always the ones who are helping other people. So I would like to say we need to continue this program. It is very beneficial and it helps people in my age group. I am 60 years old, just turned. And I appreciate what it has done for me and my family. And I will turn it back over to Sen Murray.
Well, thank you. And again, what you are hearing from is people who are just like you or me or anybody else in their lives. Things have happened, and they live in a country where we have their backs when they need it. And to take that away because Republicans want to give tax breaks to people like Trump and Elon Musk, to me, is just not how our country should be. So I want to thank each one of you for sharing your stories, for being brave enough to come forward. And I want you to know we will keep fighting, because it is worth the fight. So thank you. With that, I'm happy to answer any questions.
Senator, first on this topic, how would this bill affect, you talked about hospitals and medical in rural areas, how would it affect it in like big cities like Seattle?
Well, it will affect rural community hospitals dramatically because the vast majority of their income comes from people who are on Medicaid and public assistance. Now, somebody can think, well, I don't care because I'm not on it. But if your hospital can't afford to pay the bills because it's been dramatically reduced, the income they're getting, especially for people with Medicaid, their doors will close. That effect happens here in our state as well. I'm sure one of the doctors can explain it to you too. But would you say how much uncompensated care came to?
Ours is, Susan could probably.
Uncompensated care means somebody who comes to the hospital, but the hospital cares for them anyway. There are costs associated with that. If uncompensated care is increased dramatically because of cuts to Medicaid, our hospitals here in urban areas will also be dramatically impacted, cutting back services, cutting back their ability to see patients, and everyone, whether you're affected by any of these cuts or not, will see their insurance costs go up because insurance companies will have to charge more to cover that uncompensated care.
I also wanted to ask you about what happened with the Israel-Iran conflict and just your comments on that.
Yeah, I'm deeply worried. Israel's decision to attack Iran is dangerous, and it's unprecedented escalation. It endangers our American service members and civilians who are in that region and puts countless lives possibly at risk. So along with a lot of my colleagues in the Senate, I will of course be closely monitoring the situation. I will urge the administration, as we all are, to make sure that Americans stay out of harm's way. And I urge the Trump administration to de-escalate.
The last thing I wanted to ask you about is nationwide tomorrow, they're expecting a big day of protests, and there's been some protests here, some of which have been a little more violent, some of which have been very peaceful. Just your message about what's going on currently and tomorrow.
Well, first of all, I want to remind everybody that the vast majority of people who come out tomorrow to speak out are doing so peacefully. I urge everyone to be peaceful. Violence is never acceptable. But I think we all need to be reminded that our voices are important, that we do need to stand up and say what we believe in. That's what democracy is. That's how we all have to participate in this. And people need to speak out and make sure their voice is heard. That's what changes policy in this country. It changes the projection of where our country's going, and people need to do that. But again, like the governor and everyone else, we need to remind people that violence is not acceptable.
Senator Murray, are there specific counties in Washington you're most fearful about with the rural hospitals?
Well, in central Washington, eastern Washington, the vast majority of hospitals there have the highest percentage of Medicaid participants. So they will be dramatically impacted by these cuts. Others? Thank you all. Thank you so much. And thank you to everyone who's here. Appreciate it.